As we observe National Diabetes Awareness Month this November, we're taking a closer look at a disease that affects millions of Canadians and costs our healthcare system an astounding $30 billion annually. Today, I'm joined by Dr. Christine Palmay, a renowned family doctor with a thriving practice in Midtown Toronto, who is here on behalf of Care to Know to help us debunk common misconceptions about diabetes and provide valuable insights on managing this chronic condition. Welcome back to the show, Christine.
Thank you so much, Candace. Again, just a joy to be here.
Can you help us understand diabetes in Canada and why there is a need for more education and awareness around this disease?
So a couple of things. Number one, numbers are increasing. We have patients who are living longer, but unfortunately, due to myriad of lifestyle changes, hormonal, etc., diabetes diagnoses are on the upstroke, and we have a dwindling primary care population. So many of these patients are left without readily accessible care. It's a problem.
And there are a lot of misconceptions around type 2 diabetes. Can you address some of the myths and share the truth about this condition?
Yeah, so I think that the first thing is that I'll know if I have diabetes. Classically, people think about urinating frequently, etc. The reality is most diagnoses happen, due to a blood test, and patient doesn't have any symptoms. So it's really important to be checking in regularly to check your parameters, blood pressure, your blood work, etc. I think now with the advent of medications, in some way, we have treatments for diabetes. But unfortunately, the perception is that it's no longer serious. It is absolutely serious. Outcomes include dialysis for patients in renal failure, so kidney problems, the risk of stroke, of heart attack, the risk of neuropathies, so problems with neurological symptoms. Those are still of concern, and really, why we're treating diabetes. And I think the other misconception is that we can cure diabetes. The reality is that once you've been diagnosed, you're headed for a health journey ahead. This is a chronic disease. And the medications that we have in place, while they are excellent, they just really, they slow down the progress and the progression of the disease to avoid those terrible outcomes that I listed before. So it is not curable. It requires, daily effort. But thankfully, we have supports in place. We have medications. So the journey is not as difficult as it was, let's say, 20 years ago.
And for those who have been newly diagnosed with type 2 diabetes, what are the first steps they should take to manage this condition?
So number one, looking at lifestyle. Lifestyle changes have to happen. They're not going to absolutely treat the condition, but things like diet, exercise, weight management, monitoring your carbohydrates, absolutely important. Get informed. And we'll provide some insight as to where to go for that. Number two, sign up with a healthcare professional. You need guidance. Medications, it's now recommended that we start hard and we start early. And the other thing is that when you have diabetes, which addresses blood sugars, you have to also think of different ways of treating blood pressure. We look at cholesterol differently. Eye exams are needed. So it's not just a sugar or a carbohydrate issue. It becomes a holistic, what I call cardiovascular health issue.
And I think, when somebody's diagnosed with type 2 diabetes, you need to call in the whole team, like your family, your friends, because you need their support to get through this. So what role do they play?
Well, number one, in terms of meals, that's often a point of contention, with patients, especially, since our society is so entrenched into traditional meals, etc. Every family has different traditions, and those may have to change. And there's a rallying that needs to happen. As I mentioned, it's a chronic disease, so you need daily support to make sure that you're doing your exercises, counting your carbohydrates, taking your medications. It really does take a village.
And what are the resources that Care to Know offers for Canadians who have type 2 diabetes? And I'm going to assume type 1 diabetes as well.
Correct. So caretoknow.ca, please, for our listeners, log on, see what's available. It's a credible site. Input from medical professionals like myself. You sign up, it's free. You get emails instantaneously, with different types of health topics. And it is ever evolving. It obviously changes based on evidence and guidelines. Topics are being added. And as I've said before, it is currently right now the era of misinformation. And, we need to make sure that we are having a guide when browsing the web and getting health information from reputable, credible sites. I always tell my patients that information is empowering, misinformation can do harm.
Yeah, it was funny. There was a video that went viral on TikTok a little while ago talking about, these things you could take to prevent wearing glasses. And this is not solid information. So avoid the TikTok videos for health advice.
No, I mean, there's some things you can dabble in, but when it comes to your health, you need to go to resources and experts. So caretonoknow.ca, sign up, and I'm going to say browse safely.
All right. And I just want to let people know as well that you have a blog post up on whatshesaidtalk.com about this particular issue that people can go read if they want to go a little deeper on this topic. And thank you for joining me, and we'll have you back next month.
See you soon.